Hope. My name is Elizabeth Gibson. I'll be your host today, and I have the distinct pleasure of interviewing Dr. Alesia Greene. Dr. Greene is the medical director at Christian Care Ministry for Medi-Share, our healthcare sharing program that we offer. Dr. Greene comes to us after serving our nation for 25 years in the United States Air Force. She's a board-certified family physician. She has all kinds of leadership experience and process improvement and clinical experience as well. And she's been with Christian Care Ministry now for a little over 2 years. So we're blessed to have her with us and blessed to have her here today.
Hi, Medi-Share family. I'm so glad to join you again this week. I really had a lot of fun last week. You had a lot of great questions. So look forward to what's on your mind today as we continue to navigate to our reopening of America. So lots of new things for us on the horizon.
Excellent. Thank you, Dr. Greene. Thanks for joining us today, and thank you for your time. I know you're incredibly busy right now, so I appreciate you joining us today. So first question for you, as we're navigating this global pandemic, what is Medi-Share doing to help? Give us some ideas.
So I think one of the big challenges, no one could have predicted that we were going to have basically a 6-week stay-at-home strategy. So, trying to adjust the program to meet some of the sharing needs, because care is really transforming before our eyes, right? I would just say for most of us 6 weeks ago, maybe we used FaceTime. Now we're using telemedicine and telehealth to deliver all kinds of information from our television programs that we're watching, as you watch your news broadcasts, et cetera, to medical care. And so really trying to stay tuned in to what's happening in the medical space. We've adjusted some of the sharing eligibility for televisits. And as a matter of fact, I can't miss this opportunity to plug that we sent out our biannual member vote. That went out actually to our members today, and we're actually asking for your feedback and your vote to see if really sharing and telehealth visits is something we should continue to do into the future, because I think my prediction is this was just the kind of event that we needed to kind of push some physician offices and practices over into using technology or leveraging technology on a regular basis to deliver patient care. So we've been doing that, working really closely with MD Live, our national telehealth provider, to just kind of use them as a very simple, easy resource if you yourself have personal questions about how you should proceed if you're not feeling well, if you're ill or you have a cough or a fever. That's just been a really great aspect of our program that's really helped people to decide what to do next. And certainly, I'm hoping we'll cover it today, but all we hear about on the news the last couple of weeks is COVID testing. And there's, I think the last that I looked into on the site just a few weeks ago, there's over 20 approved COVID testing. Some give results in 3 to 5 days. Some of them now are giving results in a matter of hours. Wow. There's antibody testing. So all of these kinds of tests, I think, just for our members in general, covering and trying to understand when to get tested, all of those become really important questions to answer. And so I'll just kind of elaborate on that a little bit. As testing becomes more and more available, when it first started, we saved it for only the sickest of the sick because we just didn't have that many. But now, as it's becoming more available, you don't even need a doctor's note or a doctor's referral in many cases to have COVID testing. But I just kind of want to caution our members as we think about that and we think about the expenses of it, right? A COVID test costs anywhere from about $60 up to $155, $160. And I think that the key piece that I emphasize both to family and friends, as well as my friends who are members of Medi-Share, is remember that testing at this point really is used to decide how you should behave, right? So if you're feeling ill, it is helpful to know that you have COVID only if you need to be out in the workforce or in the work center, right? Because anybody who's sick, let's go pre-COVID. Before COVID, if you were ill, we wanted you to be afebrile, no fever, for 24 hours before you went back to work. In the case of COVID, if you're ill and you test positive for COVID, what the experts and the prevention experts are recommending is that you stay home for a full 14 days. So when I think about, should I get tested for COVID? Shouldn't I? Well, if I'm in a place where maybe my job, I need to be out in the community, and I need to be very sure whether this is just allergies or maybe a different type of upper respiratory infection versus if it is COVID, that's a really good time to pursue a COVID test so that you know for sure 100% if you're positive or not, and that should help you decide again how you should behave. Positive test, you should stay home for 14 days.
That I'm really grateful that you just shared that information with us, because I think you're right. And one thing that we've learned from this pandemic is it really has to shift our mindset. Like you said, it's no longer 24 or 48 hours. 14 days is a pretty long time, but in the face of a global pandemic, it's the safest for you and those around you. So I'm really grateful for that reminder. And if we can back up just a minute, you said when you were talking about telehealth, I just wanted to throw in a little personal anecdote from my experience. Before joining Medi-Share a little over a year ago, of course, had insurance through other jobs, and telehealth was coming into the marketplace, but it wasn't widely used. And since joining Medi-Share, I've used it several times, and I love the ease and convenience. You just FaceTime on your phone, and then they send my prescription for my flu medication right to CVS. It was super easy and convenient. So I'm grateful that Medi-Share offers that for our members. I also want to ask, are there any other resources we have for our members? I feel like maybe you've done some things that our members could maybe read that would give them some ideas.
For sure. I've tried to keep up with all the evolving recommendations and changes to really try to bring a practical advice to our members and to really our family and friends of some things we should be watching for or how we should behave. So, in terms of the pandemic, we're past the peak as folks have talked about. We're here in the United States, they've talked a lot that rather than kind of coming down the other side of the peak rapidly, we've kind of stagnated into a simmer. I've heard some of the doctors refer to it. So, we're hoping that as our citizens continue to practice good, I guess they're changing the term from social distancing to physical distancing, because social implies lots of other things, but just maintaining those public health measures of good hand washing, wearing a face mask. Remember that wearing of a face mask really is preventing you from spreading your germs to others, not really protecting you from getting germs from others. So wearing face masks, washing hands frequently, maintaining physical distance, all of those things as we open up America and we start to venture out into our communities again, those and our disciplines to those features will really be paramount in continuing to keep us on the other side of the peak. Oftentimes, I think in the news media the last couple weeks, people keep talking about the fall. Well, the basics of the upper respiratory infections and what I'll call the flu epidemic that really we suffer every year has to do, again, to social distancing. If you think about winter, especially as someone who grew up in the Northeast, winter is cold. And we
Yes.
spend a lot of our time indoors, which means that physical distancing is much less in winter months. And so, as you all take in, all these doctors are saying, well, just wait till the fall, things are going to get worse. Well, that's kind of related to human behavior and what we do and how we behave in the fall. And so that's why you're hearing those things. But again, our discipline and our adherence to the physical distancing pieces, washing our hands, and if we think we're ill, staying home and really being diligent about physical distancing, those will be key. I even remember this last flu season as I was checking in for my dental appointment, and here I am as a physician, but in this case, I was the patient. And that front desk young lady, she was, just clearly was ill, had a runny nose and was coughing and sniffling and sneezing. And I was being very polite, but really she should not have been in that office that day, because every patient that checked in, as she's taking their ID cards and having them fill out paperwork, those are all instances where we're transmitting germs and infections. So I think that's really the key. One of the questions that comes up frequently, I know it's definitely given us all something to do, is, what about cloth face masks? What about N95 face masks? I've seen so many on Facebook, like, if you just cut your t-shirt up, you can make a mask out of the sleeve. You can fold the middle into 3 parts. I think certainly just some general rules. So first of all, something's better than nothing as long as you wear it correctly. I think that's really the key thing. As I look at interviews with folks on TV, if it's below your nose, if it's in your neck, it's above your mouth so you can talk underneath, it's really not doing anything for you in terms of protecting you from spreading, the misting and the particles from your face. And so, making sure you wear it correctly. I think if tightly woven cloth tends to be better, multi-layer tends to be better. And then certainly if you are going to use the cloth masks, making sure that you're washing those regularly, depending on how long you're wearing them. Those all would be key factors in whether they're working. But, again, some are better than others. Multi-layer, tightly woven fabrics tend to be the best.
That's great, Dr. Greene. Thanks for answering that question. And I actually pondered that a little bit myself, just walking through the supermarket, because you see people putting the masks on and off and touching things and then touching the mask and then touching the face under the mask. And I think, I'm not really sure we understand how the mask is supposed to work. But I'm not a doctor.
No, you're spot on, Elizabeth. And I think just the few times that I've gone to the grocery store, trying to limit those as much as I can. But I think the key thing for me, my practice is I put the mask on in my car and I don't touch it again. I wash my hands going into the building. My local Walmart has some Clorox wipes there, so I try to wipe the front of the cart. But I'm acutely aware of trying to minimize the products that I'm touching in the store as I go through. I'm very cognizant of keeping my hands away from my eyes, my face, and that mask. That mask, I do not touch it the whole time that I'm in the store, in the public space, going through the checkout, loading the groceries into the car. The last thing I do before I get into my car is I disinfect my hands again. And then I enter my car, and that's when I take my face mask off. So kind of thinking about what you've seen on TV. How do the doctors behave when they're doing surgery, right? They're not always touching their hands, right? They're holding their hands up like this. They're not touching other things. They're not touching their face, their hair, those types of things. So those are just some basic rules when it comes to keeping germs at a minimum.
That's great. And Dr. Greene, one of the things that I absolutely love about working with you is you're so practical, and that's just such a refreshing thing, especially right now. There's lots of talking heads and lots of things being said, but I appreciate your practical advice. And we said we would answer some questions. So I want to answer some questions and then get back to a couple other things I'd like to ask you. But to answer some of our viewers' questions, let me ask, is it possible for people to carry the virus and not show any symptoms, to be asymptomatic? Does that happen?
So, I think it's always a matter of degree. So no matter what type of respiratory infection that we're talking about, when you're first exposed to the infection and it's in your body, there always is an asymptomatic phase. And are you infectious during that stage? Well, maybe slightly infectious because you're not having symptoms. So what that implies is that if the virus is there, it's not there in high concentrations to the point that you will be spreading it a lot. But, part of our challenge in this pandemic and why we did the stay-at-home orders for so long is really to try to understand how many days are people asymptomatic before they start to show symptoms. And then, as you talk about viral shedding, certainly the sicker you are, the more viral shedding that you do, right? So once you start to develop symptoms, that's when you're really putting out a lot of virus and really when you want to be staying at home. Again, if there's questions in your mind, you know how there's always that day or two where you're like, am I sick? I'm starting to feel sick. If you have readily access to testing, typically they're still looking for symptoms of cough. Some sites still require fever, but you may or may not realize the CDC did expand the symptom list. So, it can really be any flu-like illness type symptom where you can have a runny nose, sneezing, coughing, sore throat, loss of taste, loss of smell. So kind of all of that big family of symptoms that I think all of us have experienced where, you're like, am I sick or not? You can certainly go get tested at that time. And the only reason, again, I bring that up as we're talking about viral shedding, if you're asymptomatic, while it is possible that you're spreading virus, you're not spreading very much because there's just not much virus. It's when the volume of virus goes up as the sicker you get. And so once you're symptomatic, that's when you absolutely know you should stay home and physical distance or social distance.
Okay, now I have two follow-up questions from that. Viral shedding? This sounds like a really bad idea. What exactly is viral shedding?
So, it's basically when you get a viral infection, right? It usually is entering through your nose, your mouth. It could enter through your eyes. Any wet, moist surface of your body is how virus enters your body. And if you become infected, that virus kind of takes hold and starts to replicate and starts to duplicate itself and starts to multiply. When it gets to a certain level, you begin to feel ill and you become sick. Now, again, as we go back to these face masks, how people spread infection is usually through the droplets. We talk about contact isolation, but it's through the droplets, just simple things like speaking, coughing, laughing. All of those kinds of things, you are putting those microscopic droplets out into the environment, and there's virus in there. And again, early on, when the virus is brand new in your body, small amounts of virus. But as you become sicker and sicker, and there's more duplication and replication, the amount of virus in the body, and therefore the amount of virus that's coming out when you cough or sneeze is much, much greater. So that's what viral shedding is. And as you talk about asymptomatic spread, that's really what the doctors are talking about is, how long is the virus in your body replicating itself before you become aware that it's there and because you don't feel good.
I see. And I noticed that the more we talk about the virus and face masks and not touching our face, the more I want to touch my face. So suddenly my cheek's itching, my forehead, everything is itching. Don't worry, I'm at home and I wash my hands.
As soon as you put the mask on, right? As soon as you put the mask on, suddenly that's like all you can think about.
Scratch my nose.
That's right.
So speaking of that, let's tap back into the super practical Dr. Greene and ask another question from one of our viewers. I know that you're a mother of
3 boys.
Three. Okay, good. I thought it was 3 boys. So
3 boys.
How do we keep kids from touching the mask, moving the mask, touching under the mask, touching everything in the store and then touching the mask? What practical advice?
I think that those of us who've had the young babies, some of it comes down to, first of all, don't take them if you don't have to. So that's one
Excellent.
thing that you can definitely try. But if you have to, I think any kiddo who's, depending on the maturity level, 3 or 4, you can try to just, make it into a game, something to that effect. I do think, you're a little bit stuck there. Concentrating on hand washing, making it a game for them. And really, unless, you need to take them into high density areas, I'm not so concerned taking the kids out to the park or taking them for a walk on the beach, those kinds of things. Really, it's those locations where there's high densities of people. That's really where we're most concerned at this point. But frequent hand washing, having your little bit of the hand sanitizer that, again, you can do, frequent hand washing at home, and then just making it a game. My kids all have tried on their face masks, it's something new and cool.
Right.
They all have their own that they like. And then, I don't know, you can incentivize and reward them for those who, I saw you touch it, I don't know, you could take away 1 point or whatever, and whoever wins at the end, they get a prize.
Gamification of COVID-19. I love it, Dr. Greene. Brilliant. So let me ask you another question from one of our viewers. It actually came in a minute ago, but I wanted to get back to it. And that is, you've described in your blog, and then last week you also discussed with us that pandemics have phases or stages. Can you discuss with us where we are right now in this pandemic, the COVID-19 pandemic?
Yeah, we're really in the surveillance phase. So we've already, as you think about it, there's the identification phase, then you get your rapid rise, and then, we're on the other side of the peak and we're in the surveillance phase. So that's why testing is talked about so frequently. And I think the blog will be coming out tomorrow, where I'll kind of highlight specifically about what the 3 phases are during surveillance phase. But the bottom line is, now that we've gotten past the bulk of the first wave, we're going to be looking at surveilling our population and trying to do containment and contact isolation. So, that's why that testing and how people behave becomes so important. So if you're sick, staying at home, and then public health resources will try to also come out to track down and do isolation of the people that you've been near. So if you're positive, it's a very tried and true public health strategy, where we go out, we identify the people that you've been in contact with, and we ask them to be isolated too, even if they're not sick right away. So knowing if you're sick with COVID becomes super important, again, because it dictates how you should behave. So at this point, we're in the surveillance phase. I hope that we will not have continued outbreaks, right? Because then we would go back into an acceleration phase, a peak phase, and then, again, back down into a deceleration and surveillance. So those are really the phases that we'll continue into. We're in the deceleration phase. We haven't gotten as low as we were hoping, right? But now that we're opening back up, how we behave and that contact isolation and surveillance becomes so important.
Excellent. And if our viewers wanted to hear more about this, they could read your blog on the stages of a pandemic?
That's right.
Okay.
The blogs are out there, all of them. The very first one, I did talk a little bit about the phases of a pandemic. And again, it's a matter of public health measures, managing our medical resources, and managing how we behave. And those will be adjusted up or down depending on where we are in the phases of that curve.
And while we're looking at adjusting and trying to manage what's happening, Dr. Greene, you personally, would you think that it's a good idea or a bad idea for us Floridians to hit the beach right now?
I think if you can be disciplined and do physical distancing, again, it's a wide open space. If you can maintain 6 feet apart, not go in groups greater than 10, and you can be disciplined with that, I think it's going to be fine. At some point we have to venture back out into the world.
Right.
COVID is going to be with us for a while. I think the big adjustment for us is just kind of learning to adapt to, you hear it said all the time, the new normal, just, avoiding. I notice it even with my neighbors now, right? When I meet them on a walk, I'm like, I want to walk right up to them because that's what I'm used to doing.
Right.
But it's trying to basically keep my distance, which doesn't feel exactly comfortable. But make sure I'm keeping my distance. So I think that's true of parks, beaches, walking trails, running trails, even again, when lots of people have been outdoors, very active, just be cognizant and try to maintain that 6 feet of physical distancing. And if you're going inside to buildings, those kinds of things, like if you're going to use the public restroom at the beach, those kinds of things, make sure you have your hand sanitizer, that you're practicing the 30 seconds of washing with soap and water while you're in the bathroom, which should be part of your regular practice.
Which we should be doing anyway.
That's right.
Right.
And then, and just, again, making that part of your usual routine.
Once again, Dr. Greene, thank you for your time. I'm going to say a really quick prayer just to wrap us up and send everyone on their way.
That sounds wonderful.
Father, thank you for this time together. Thank you for people like Dr. Greene who are willing to give their time to help the rest of us just understand what's happening in the world today. Lord, I think it's scary and confusing at times, and I just ask that you would wrap your arms around your children so that they would know they're your children, and let this be a time of revival, that your church will go out and be the hands and feet of Christ and serve like we've never done before, that we would reach out to the lonely, to the widows and the orphans, that they wouldn't be alone, and that we would focus this time on how you want us to draw closer to you. We ask all these things in your name. Amen. Thanks, everybody, for joining us.